Hi, I'm Dr. Matthew Ferroni with the Mercy Urology Clinic. One of the most common questions I get from patients, and even family members and friends, is how do I know if I'm being screened for prostate cancer? Well, the number one way we screen for prostate cancer is with a simple blood test called a PSA, or prostate-specific antigen. The reason we screen for prostate cancer is if we find it early, we're much more likely to be able to treat that cancer and often cure it. Current guidelines recommend screening for men starting at age 45 if there's no known family history of prostate cancer, or as young as 40 if either a father or brother have had a history of prostate cancer, or if men are African American. To find if you've had a PSA screen, simply log into MyChart. Once logged in, go to Menu and Test Results. This will list all of the test results you've had here at Mercy. You can either scroll through this list to try to find PSA or prostate-specific antigen, or use the search bar and type in PSA or prostate-specific antigen to find the result. General recommendations are for PSA blood tests to be done every 1 to 2 years. If you find a PSA and it's been longer than 2 years, we recommend you talk to your doctor about getting an updated version. It's important to note that the number for normal PSA has changed over the last few years. It used to be that 4.0 was the cutoff for all men. Nowadays, we actually use your age as a reference point for what we want that PSA to be under. We also encourage you to have this conversation with your doctor and, if appropriate, request a referral for prostate cancer screening. If you don't have a primary care provider, or maybe your primary care provider recently retired or moved and left the system and you haven't found a new one, now's the time to reach out and find a new one. We encourage you to reach out to the Mercy Find a Doc system, call the phone number, and they can place you with a primary care provider close to you to get plugged back in, not only for prostate cancer screening, but for overall wellness.